Can't wait to go to the doctor, Mom. Well, I know I've never said it. I'm pretty sure you've never said it. None of us are ever excited to go to the doctor's office. Why? Because it usually ends up being a morning or afternoon or even whole day exercise and frustration. You could be waiting in the waiting room for 10, 15, 20, 30, 40 minutes, depending on the day, depending on the doctor. Well, now I think we have a solution: physician assistants. Physician assistants are medically trained professionals who hold a master's degree and pass national certifying exams to practice. They work under a supervising physician and within their scope of practice. And this fancy "within their scope of practice" simply refers to what they can and cannot do with or without the supervising physician's guidance and signing off. Physician assistants are flexible, knowledgeable healthcare providers. Now, both men and women across the country work as physician assistants. However, that was not always the case. The PA profession was completely male dominated in its early years, but that was soon changed by the one and only Joyce Nichols. I admire Joyce Nichols for her long career in medicine, paving the way for women of all backgrounds to pursue a career as a physician assistant. She broke barriers in the physician assistant educational setting at Duke University by challenging stereotypes. She also greatly served her community by providing care for many who would otherwise face a life with no health care at all. Joyce Nichols started her medical career as an LPN at Duke University in their cardio unit. She worked in the cardio unit for about 5 years, where she learned from her colleagues about this new PA program starting at Duke University. She was later asked why she even pursued a PA degree and career in the first place. She responded saying that it was a way to advance her earning power and gain more respect in the workforce. She successfully graduated from Duke University's Physician Assistant program in 1970. However, it wasn't always an easy ride. Of course, nothing in life ever is. Joyce Nichols' path was blocked by many things. First of all, she was a woman. No woman had ever become a physician assistant before her. Second of all, she was African American. There were only a few other African American men that had successfully and even attempted to matriculate through the program. She was also not former military, and the cost of attending the physician assistant program, like any other medical program, was steep. The physician assistant field was originally created by Dr. Eugene A. Steed Jr. at Duke University, like I said, back in the 1960s when they realized there was a lack of physicians in America. The military connection was there because Dr. Steed created the PA curriculum around the knowledge he had from the World War II physicians that came back and had found a way to train their men to provide more effective care and have a more robust knowledge of medicine to provide on the battlefield. Joyce Nichols held many positions in both hospital boards and in the community to improve the lives of her neighbors. She opened the first rural clinic in Durham County, and which showed that a mid-level practitioner could be successful in this setting on their own and cost-effective. She set this up with none other than Dr. Eugene Steed himself. In 1972, she had the Lincoln Health Center take over the clinic when the initial grants began to run out. She continued to work for the Lincoln Health Center until 1995. She also was a commissioner for the Public Housing Authority, where she advocated for better treatment of those who lived in public housing and to improve the conditions. This was always near and dear to her heart because she herself had lived in public housing during nurses training. During PA school, she even brought a lawsuit against the Housing Authority when she felt that the public housing were not conducive to the people who lived there and they were not being treated the way people should be treated. In 1991, Nichols received the Nancy Susan Reynolds Award for being an unsung hero in the category of advocacy. With her award, she was able to give some of the money to the Lincoln Community Health Center and part of it to set up a scholarship fund for students in public housing who wanted to further their education beyond high school. Joyce Nichols was a trailblazer in the healthcare field and in the PA program at Duke University. She showed women everywhere that they can complete a rigorous healthcare and compete with the men. Healthcare is more than writing prescriptions and just performing surgeries every day. It's also the connection you make with your patients and your community. Every healthcare professional, from the world-renowned neurosurgeon to the recently graduated nursing student, can impact the lives of the people they care for daily. Thank you.